So with sickle cell anemia, affecting my eyes and starting to kill my retina. I'm trying not to go blind, and this was a great first step. So basically, with this surgery done in both eyes, we did a look around. Nothing had changed. I felt comfortable proceeding with the right eye. We already knew that the right eye was in worse shape than the left. So we went in and we did this right eye first. And honestly, there's a lot of my doctor prefaced this by saying look, this can be painful for people, but some people say it's like their eyes are being hit by rubber bullets. I'm like, oh, hey, awesome, let's go. Joke's on you, I'm into that shit. No, but ultimately, he prefaces by saying, look, you're a sickle cell patient, and y'all are just built different. So most of my sickle cell patients don't really have a problem with this. I recommend taking whatever sort of pain medicine concoction you would normally prepare, when you're in pain, and just take that beforehand if you feel you need to, and then we'll get going, and it goes by pretty quick, and you should be fine. And he basically described that you ever been to a rave? Again, this is a younger dude. Not that older people don't go to raves. I mean, it's not like raves are a new thing. You can be 80 years old and having been to a rave, but young dude. So I was like, this is probably in the forefront of his mind. You ever been to a rave? Yeah, I'm like, yeah. He's like, those green lights, they shine, to give it kind of a cool feel. That green lights they have all over the place. Yeah, I know, yeah. He's like, yeah, it's basically it's that. And he didn't even say basically. It's that exact laser that I'm going to be beaming into your eyes. I'm like, okay, let's go. So really, the most pain I felt in this process was just my eyes are light sensitive. My eyes have been, I don't know, I think my eyes have always been light sensitive. So to me, I think the most painful aspect of it was just the fact that I was making sure I have the right sushi. Because I have my sister and my sister's boyfriend are in town, and I want to make sure I'm not eating their sushi, because that would make me sad for multiple reasons. All right, no, we're good. This is mine. Good old-fashioned dragon roll. Anyways, so, I'm going to get, rave lasers directly in the eyes. I'm light sensitive, so I'm like, okay, ow. It's going to hurt. Even when we were doing the photos of my eyes, some of the lights that have to shine, I was like, it hurt a little bit. It wasn't enough to, really make a big deal of it. Even as it was happening, when we were taking the photos, images of my eyes, I was just noting to the doctor, yeah, that does hurt. But it was a very casual, yeah, that does hurt. But it wasn't I need you to stop or anything. It's just more I want you to know that because I want to make sure that that's normal. But it was. So anyways, with the laser, he was like, all right, go shine the rave laser in your eyes, essentially one eye at a time, and then that eye, as we treat it, I actually move your eye in different directions, zap the spots I need to zap. And then you might feel some mild, you might feel some burning or, whatever in the back. It's everybody's a little different. But he's like, you will basically, after we get far enough in that process, you'll basically lose vision in that eye temporarily. Now, I'm not really losing vision. What he explained was that, it's like staring at the sun. The light sensors in your eyes kind of go, yeah, we're not doing this, and they just kind of dim. They just kind of turn off because they're we're getting so much light at once. We can't even fucking do our jobs properly. So we're just gonna take a little coffee break. And so basically, as he completed the right eye, it everything on this side just blacked out, and I was just like, oh, so this is what it'd be like if I only could see out of one eye. Interesting. But that only lasts for about 15 minutes. And then after 15 minutes, you start to see everything fade back in. You're like, oh, okay, cool. Yeah, the world's still there. This eye still works. Great. And it was very mild pain. It felt again, the brightness, the pain of the brightness was kind of the worst part. But the actual laser itself, I don't know. It's such a low level pain. I've had shampoo in my eyes that hurt worse than whatever this was. So I was like, all right, I'm good. Again, take it with a grain of salt. If you ever have to have this done and you don't have sickle cell anemia or some other painful, debilitating, disease, then you might feel differently about it. But for me, I was like, oh, the things I've experienced are this is pretty low level. I can do this every day and be fine. So with that being successful, he came back in maybe 5 minutes to check in, and then another 5 minutes he came back in just to see if I wanted to do the other eye. And vision was coming back in the right eye, and I was like, yeah, I feel pretty confident. Like, let's go ahead. So we did the left eye as well. Same thing, rave laser in the eye, some light sensitivity pain, and some mild burning in the background. And then the vision went away, and then slowly but surely the vision came back. That was it. I didn't lose any additional vision because, if you're doing the procedure properly, I'm not supposed to lose any additional vision. He said that he was specifically careful with this procedure because he's like, I don't want to hit any of the areas that are kind of on the borderline. He's like, I only want to get the areas that we know for sure, they're done. They're either so far into the process of dying or they're absolutely dead. They're not helping you anyways. They're not providing any vision as we speak, so I'm just going to go ahead and zap those. But anything that's kind of too close to the areas that work or whatever, not fucking with it. So we did all that. I since they had to dilate my eyes to do all of this stuff, they gave me the little plastic sunglasses because I didn't think to bring any, and I walked out. And I'll be checking up with this doctor again, I think in a couple of months. So I think 2 or 3 months out, I'll be seeing how I'm doing and how everything's progressing.